All right, what do you make of this? As your kid enters third grade, medical experts just put out a recommendation. They got to be completely vaccinated, right? You got to get your vision check, right? They check the hearing, right? Now they think that you should be screening for anxiety and depression. The U.S. Preventive Services Task Force says we're not catching it early enough by screening teens. Got to go earlier. Dr. Kelly Posner, Columbia University, psychiatrist, professor, winner of the Presidential Medal of Freedom for work in preventing suicide in the military, good friend. Thank you for being with us, Doc.
I'm so happy to be here.
Now, let's deal with the pushback. People are going to hear this and say, too young. Well, we're not pumping all our kids filled with pills. It's out of control already. What should people know about this?
Well, first let me say it's a really great step and a really important one. And let me tell you why, right? There are a lot of kids out there that are suffering. They're actually, anxiety and depression are overwhelmingly the biggest health and well-being challenges that face our kids. And here's the good news. These are treatable medical illnesses, right? But if we don't know who we have to treat, we can't do anything about it. But let me just tell you the numbers.
Can you pick it up, though? Because one of the point of pushback to that will be, you can't pick it up like you could leukemia or diabetes. This is soft science. You don't know what's anxiety versus just being nervous. Is that true?
It is not true. We know how to ask about symptoms, the way we screen for anything, and we have to make it routine. That's the thing. Like if we want to prevent heart attacks, right, we take somebody's blood pressure. So we know that this is what we need to do to find the people who need help. And like I said, these are very, very, very treatable illnesses, right? But we have to make it routine and identify the ones who need them. You know, 1 in 3 kids will have anxiety, and we know that it's gone up substantially since COVID. We don't know quite exactly how much, but the biggest problem and why this recommendation is so important is the access to care. Overwhelmingly, the kids who are suffering with treatable issues are not getting care. Get the statistic. Do you know that if you're a teenager who has anxiety, you won't only usually wait months, you'll typically wait years before you have contact with anybody.
And what's the reality of kids being given medication? The concern will be that you're going to wind up changing them in a way that's for the worse. Do we have enough data to show what the difference is when kids get medicated after diagnosis versus un? Yeah,
we know that these are treatable with simple, modern antidepressants, right? Prozac, Paxil, it treats depression incredibly well, treats anxiety incredibly well. They're non-addicting, et cetera. They're very simple meds, right? So it's the opposite of all the fear that we're going to put them on benzodiazepines, and that's not what a doctor would prescribe. Depression is the biggest cause of suicide, this genetic medical illness, treatable, that we don't think of like cancer. You would never hear the word choice when it comes to cancer. And guess what that stigma does? That leads up to 75% of people and kids to not get these simple life-saving medicines that they need.
And also, you say that, look, just because they're screening your kid doesn't mean that your kid has a problem, or even if they have a problem, will need medication for the problem.
Exactly, exactly. Again, 1 in 3 kids will have anxiety. Doesn't mean even if you're screening that's going to mean treatment. It just means you have to look further. And the only way that we're going to find them is by doing that. And the thing is, we as parents, as clinicians, as a community need to think about these things like we do everything else, like blood pressure or vision testing.
Now, you gave me a big stat. By the way, this is the way our relationship goes, is that Kelly's always telling me that I've gotten something wrong or that I needed to know something else. I am very worried that people don't treat physical health and mental health as holistic. You say there is a change and you can document it.
Yes, there was a recent study that came out that shows the overwhelming majority of the nation think of physical health, mental health the same way as physical health, But we have many years of stigma and shame and silence to overcome. This isn't a real illness. I'm weak if I ask for help, right? And
especially men.
I was going to say, get this statistic. So we know things have gotten worse since COVID. So girls, 12 to 17-year-old teens, going to the emergency department for mental health reasons had increased 50%. Well, maybe that's good, that's help seeking, right? Only 4% of boys, because boys are taught.
We have to flip the stigma from if you get treatment, you're weak, to if you won't get treatment, if you don't care about yourself, you're weak. And you're helping do that. People can go to the Columbia Lighthouse Protocol. You go to the Columbia Project online. You'll see how you can help people identify their need to get treatment. And it's much easier than you think. Kelly developed it. It's working well everywhere they use it. Dr. Kelly Posner, thank you so much. I appreciate you.
Thank you, Chris.
Helping us understand, that's how we get better.
And you said sign of strength to ask for help.
Right?